Hello everyone, my name is Maria Salazar and I will be talking about the elderly Latinx and medication adherence. First of all, I want you all to imagine one of your grandparents or even your parents and think that they've been prescribed medication to manage a health condition such as diabetes or hypertension. But what if I told you that they were now down to their last pill? And what does this mean? For an elderly woman named Rosa, getting her refills isn't as simple. She doesn't drive, and the pharmacy hours don't fit with her son's work schedule. When she makes a call, she struggles to communicate with the pharmacist who speaks English. Without her medication, her health condition can't be well managed and spirals out of control. A missed refill can become life-threatening. But here's the thing. When Rosa has support, she is reminded about her refills, and a family member helps her set these reminders and keep her on track. This is where my research comes in. I want to understand how social support affects medication adherence among the elderly Latinx adults who have diabetes. By listening to their stories and their experiences, we can make proper solutions that make medication adherence and management safer and easier for them. Thus, my research question is, in Latinx elderly, how does the lack of social support compared to strong social support impact diabetes medication adherence and management? Through focusing on this population, I hope to better understand the barriers and the challenges that they face that impact the role of medication adherence. What can their providers, community members, and us as family members do to help individuals maintain good health? I will be working with Dr. Diaz Ambuja at the UCI Senior Health Center to recruit patients that follow our criteria. Participants will be recruited for one of two groups, Group A or Group B, based on the social support that they have. The criteria is as follows. They must be 65 years or older who identify as Latinx and have diabetes and use medication to manage their condition. Why is this important? Well, the elderly Latinx population is often overlooked in the healthcare system. Latinos suffer from many health disparities in the U.S. that impact their health and their health management. But what are the differences in knowledge, understanding, and reception to treatment or good health management that impact the elderly in specific? This is what I'm hoping to look more closely into, because medication adherence is not just about health, but it's also about bringing joy and improving the quality of life for these individuals. Thank you for your time, and if you're interested in being a collaborator or a partner, feel free to contact me.